Hello, I am here to discuss aortic stenosis. Aortic stenosis occurs when the aortic valve narrows, and this narrowing prevents the valve from opening fully, which reduces or blocks blood flow from the heart into the main artery to the body, which is the aorta, and then onward to the rest of the body. Aortic stenosis is caused by narrowing of the orifice of the aortic valve and leads to obstruction of left ventricular outflow. When the blood flow through the aortic valve is reduced or blocked, your heart needs to work harder to pump blood throughout the body, and eventually this extra work limits the amount of blood it can pump. And then this causes symptoms as well as possibly weakens the heart muscle. So some signs and symptoms of aortic stenosis: hemodynamic changes usually occur when the valve becomes stenosed to 1 centimeter or less. So if you look at this diagram here, you'll see a normal valve here that has 3 leaflets, and then as the valve kind of stenoses, you'll see the limited amount of blood flow that is able to go through that valve. So I like this diagram because it actually explains what happens when aortic stenosis occurs. There you can actually see the visual. So some people with aortic stenosis may not experience symptoms for many years. And then all of a sudden, as the disease progresses, they start getting some of these signs and symptoms, including a heart murmur, more pronounced heart murmur occurs, chest pain, tightness with activity, feeling faint or dizzy, shortness of breath, especially when they had been active, fatigue, heart palpitations, and then of course not eating enough, not gaining enough weight. So the heart weakening effects of aortic valve stenosis may lead to heart failure. Heart failure symptoms include fatigue, shortness of breath, and then swollen ankles and feet. Some risk factors of aortic stenosis is getting older, so older age, certain heart conditions present at birth, congenital heart defects can occur, history of infections that affect the heart, having cardiovascular risk factors such as diabetes, high cholesterol, and high blood pressure, chronic kidney disease, and then also a history of radiation therapy to the chest. So some ways to prevent aortic stenosis would be taking steps to prevent rheumatic fever. Therefore, if a patient has a sore throat, making sure that they go to the physician and be treated with antibiotics if they do have strep throat. Addressing risk factors of coronary artery disease, including high blood pressure, high cholesterol, and obesity. And then taking care of your teeth and gums. There has been a link between infected gums leading to infected heart tissue as well. So the pathophysiology of the disease is kind of on a diagram here. It makes it a little bit easier. So aortic stenosis limits forward flow of blood from the left ventricle. So then there's an increased blood volume and pressure in the left ventricle, leading to enlargement and thickening of the ventricle, of the left ventricle. There's also an increased blood volume and pressure in the left atrium that leads to enlargement and thickening of the left atrium, therefore leading to pulmonary congestion. There's an increased work for the right ventricle and then can lead to right ventricular failure. Also having a decreased cardiac output and then leading to angina, fatigue, postural hypotension, and dizziness as well. So some testing options for aortic stenosis is getting an echocardiogram done, an ECG, chest x-ray, stress test, CT scan, cardiac MI, and then in some cases, cardiac catheterization. Some treatment options for mild or moderate asymptomatic aortic stenosis is pretty much the watchful waiting period. So this is where patients should have a checkup with their physician about every 6 months to make sure that the disease hasn't progressed. And then the doctor will probably encourage patients to make changes to improve their overall heart health, meaning tweaking their diet to make it healthier, working on weight loss, quitting smoking, managing stress, exercising, also depending on their symptoms. Some medication, there's no pill or cure that can improve aortic stenosis, but there are some medications that can control symptoms, such as ACE inhibitors, which open blood vessels more fully, medicines that tame heart rhythm problems, beta blockers, which slow the heart rate, diuretics, which lessen the amount of fluid in the body and ease stress on the heart, and then aspirin and statins may also help. Types of treatment options as well, when we're talking about surgery, when the asymptomatic patient begins to manifest signs and symptoms due to the progressive narrowing of the aortic valve, the only effective therapy at that point is surgical replacement of the valve. So open heart surgery or a sternotomy is the main surgical treatment. The gold standard treatment option, however, is something called transcatheter aortic valve replacement. And what this is they don't actually take the non-working valve out. They actually go in and put a new valve kind of in front of the non-working valve. And they usually go up through the femoral artery to do this surgical, or to perform this surgical procedure. The prognosis: with surgical repair of the disease, it is curable. Asymptomatic patients, even with critical aortic stenosis, have an excellent prognosis for survival with an expected death rate of less than 1% per year. Only 4% of sudden cardiac deaths and severe aortic stenosis occur in asymptomatic patients. So that is what you need to know about aortic stenosis. Thank you.